Dr. James Behr. I am a physical medicine rehabilitation and pain management specialist at CONA. I've been here for the past 9 years. I generally treat people with back and neck pain, among other pain complaints. I did my medical school at University of Rochester in New York. I did a residency in physical medicine rehabilitation at University of Washington, and then a pain management fellowship at UCLA in California. When we're treating someone with back or neck pain, we typically take a stepped approach. We generally start with the most conservative things first, often including physical therapy, lifestyle modifications, and then after that we'll utilize other means, including sometimes medications and occasionally procedures. The goal of all of these treatments is to decrease the pain and improve the level of function for people.